Hey guys, is everybody ready for the day 3 tonight? Get all my chat on here so I can see y'all. Just waiting for Jennifer to pop in, and I have a new game for y'all, so super excited. Found a new one. Hoping everybody will like that. This one is a new connection game that I was working on. And I thought, well, I think I can change this into an EKG one. So we'll see how it works and see if y'all enjoy it. I like playing new games. So you have to tell me how you like it. So we're just waiting for Jennifer. There she is. We can't hear you, Jen. Can you hear me okay?
Now you can probably hear me.
Yeah, now I can. Yeah.
All right. Excellent. So guys, welcome into the last night of our 3-day EKG challenge. You're in for such a treat because we're going to kick it off with my good friend, Michelle, who has a special treat for you because even if you've seen her games before, this is new questions. So let's go ahead and I'm going to turn the floor to Michelle and then she'll kick it back to me when she's done.
Okay. All right. Sounds good. Okay. Get your fingers ready and type in the answers. And those on Facebook, I'm watching the Facebook and I'm watching the Zoom for the answers. So we'll see who does. And again, this is a new game, so we'll see how it works. I haven't done this one before for y'all. It's totally and completely new. Let me get my chat up here so I can see y'all. And if my fingers don't want to play very well either. There we go. Okay, now I got it. All right, so this is a new one. And it's a connection game. If anybody's been playing connection games or Wordle or any of the word games, I took this one. You can see down the bottom because I want to give credit when somebody makes a game and they give it to instructors and let them use it for free. I want to give them credit. So this game was created by Amy Fisher. I didn't physically make the game, but I changed it. They allow you to put new questions and things like that. So I give that as a disclosure because I want to be fair for people that have that creative license. Okay, and I actually put a zebra on there, as you can see, and I'm wearing my baby zebra shirt on tonight. So the way this works is if you've done connections, you get a whole bunch of words and you kind of try to find out what the connection is between the words. So again, I made this like a EKG. So there'll be one example, and then you can kind of see how it goes. And then you have to type in what the connection is. So let's see how this works. Here we go. So we'll kind of play Facebook against Zoom. So I am watching the chat. Obviously, Zoom has a little bit more of a way to get ahead on this because it's a little bit faster. So this is the example. This is how this works. So if you were to see this word, red, if you got the connection to tell me what these were right away, you get 5 points for this. But now you have another one and it's blue. So we have red, blue. For 2 points, we would see the word brown. And if you need all 4 points, it's the word pink. So the connection is that these are all colors. So obviously that was an easy one, right? Okay, so here's the EKG part. Let's see how this works. Okay, so number one for 5 points, type it in if you think you know what the connections are for this. For 5 points, the letter P, I'm going to give it a couple little seconds. Oh, Brenda has already put in waves. What? Brenda got it for 5 points. Oh my gosh, yes. So QRS was for 3 points. The T wave is for 2 points. And the U wave is for 1 point. And the answer was EKG waveforms. Yes, Brenda, look at you go, girl. Brenda, give yourself 5 points because you typed that in super, super fast. And again, I know that Facebook takes a little bit longer. There is a little bit of a lag, but I am keeping an eye on them to see how people are typing in there too. Okay, so round 2, here's our next one. For 5 points, sinus node. For 5 points, sinus node. I'm going to see if anybody's typed it in. We've got conduction electrical pathway. Oh, whoa, y'all are just super fast typers. That was Carrie and Jacelyn electrical pathway. Yes, maybe I made this too easy. And Lee on Facebook got electrical. So give yourself 5 points because you all got it before I put 3 points in. So sinus node, AV node, bundle of His, and right and left bundles. So the electrical system in the heart, Jennifer went over that the first night, how the electricity goes through the heart in the normal pathway of electricity. Okay, y'all are super smart. Okay, here we go for the third one. PR, I'm gonna give it just a second. Oh, Brenda, look at you. She is going to town, Jennifer. We have to give her something. And Carrie again for 5 points. Y'all got this already. The PR, I'll give you the rest of them so you can see. The QTC, Lee is saying intervals for 2 points, ST. And the last one is R to R. Yes, those are all the intervals of the heart. Those are the things that we look for. We want to know what normal PR interval is, what normal QTC is, what normal ST segment is, whether it's a short, depressed or elevated, and R to R. So I put all the normals down there first. Okay, let's keep going. All right, so here we go. Jennifer introduced these words. Reciprocal for 5 points. I'll give it just a little second. Hey, Matt. Oh, I see Carrie's already put it in here. Leads. You are good, Carrie. And Gray. Gray said leads. Yes. And so did Deep Chatta on Facebook said leads. Yes. So Jennifer talked about reciprocal leads, contiguous leads. I threw in some other ones, the lateral leads and the inferior leads. So those are just a couple of the leads of the heart. Yes, y'all got that. All right, so give yourself some points. Most everybody got that at 5 points. Jennifer, I think I made this way too easy for them. Or you were so good the other night on day 1 that they know all the answers. All right, so here we go. Let's see if I made this one a little bit harder. For 5 points, absolute. For 5 points, absolute. What was I thinking? Oh, Gray is talking about refractory periods. Keep going with that thought process because that is actually one of my clues. Absolute, relative. Matt says refractory period. That's actually one of mine. And my last one is refractory period. So absolute, relative. So what I was looking for was parts of the T wave. Jennifer specifically was talking about how that T wave is and the portions of the T wave. So if there was electrical activity that hit on the absolute refractory period, you would not get another electrical impulse. But if it hit on the relative refractory period on the T wave, you could get R on T. So that's where I kind of wanted it. You all were in my same process, my thought process. I wanted you to think about the actual T waves. That would maybe be a little bit trickier. Okay, this is the last one on these, and then I have another group. Okay, so let's go. 1/3 the size. 1/3 the size. Up. Q wave. I've got Carrie is typing Q wave. Courtney, pathological cues. Brenda cues. Gray cues. Yes, you've got me already at 5 points. 1/3 the size. The Q wave, these are the things that you have to watch out for. They need to be less than 1/3 the size in most notebooks, or sometimes a quarter the size of the R wave. 3 milliseconds wide if they're in a pattern, or stabbies. And Jennifer alluded to stabbies. Those are all pathological things. You have to be looking out for them. They may be telling you you have an old MI, you might have a new MI, or you may have a pattern called Holcomb. So yes, deep chata, Matt, everybody's looking at Q waves. Lee, yes, everybody's got that Q wave. So that one wasn't too hard. All right, so here's another couple of questions. In this round, so I did a couple different ways. On this one, you're going to see 3 of the clues. You have to tell me what the 4th one is in the sequence. Let's see what you think about this. So see how this works. So let me give you an example. Here's one of the clues: red, orange. This is just an example. Yellow. And what would be the 4th in that pattern? That's a pattern. And the 4th in that pattern would have been green because the connection was colors of the rainbow. All right, so let's see how I did this as an EKG. We'll see if it makes sense. Okay. Oh no, Courtney, you're supposed to participate. Yes. You keep on participating because this is fun for everybody. And besides, I want you to figure out if this works as a game or not, because it's a new game, and sometimes new games I have to play around with to get it right. Oh, look at Gary. Gray, I'm sorry. I keep saying Gary on my names here. Inverted. And Gray's already got it. Tall and peaked. Symmetric. And the last clue would be a reverse check mark, because those are some of the T wave abnormalities that Jennifer chit-chatted about. So yes, T wave abnormalities. Y'all got that. Lee and Matt, yes, y'all all got that one. So that one wasn't too hard. I tried to make that one not too easy. Okay, so let's see, or not too hard. All right, let's see how I did on this one. R to R interval. These are the things you're going to be looking for, is R to R interval. Oh, look at Courtney. Rate, regular and irregular. I think y'all know exactly what I was thinking. Regular, rate. Oops, come on, click there. And intervals, yes. These are all the normal sinus pointers that Jennifer likes to talk about. Make sure you know whether the rate is there, whether it's regular, what are the intervals, are they normal, and what is the R to R interval. Okay, let's see, where am I? Okay, let's see. Okay, here we go with another one. 5 points. Are y'all keeping track of your points? Keep track of your points. PR interval is 120 to 200 milliseconds. Give y'all a second to think about it. The QRS is less than 120 milliseconds. What do you think about this? Normal intervals, Courtney and Gray, you're typing in Courtney and Carrie, normal intervals. I think you know exactly where I was going with this. QTC, normal sinus rhythm, Matt says. Under 1460, and axis is 90. Yes, those are all normal EKG intervals. I put all the normal intervals down there. So y'all got that one. KJ, George, yes, you got that one. All right, let's see. I just have a couple more on these. All right, here we go. Narrow or wide? Narrow or wide? Narrow or wide? QRS complex, maybe. Maybe. Let's see. Fast or slow? What is my brain thinking about? Sometimes I don't even know what my brain is thinking about, because I hear all kinds of voices in my head, as Jennifer knows. I have rate and SVT, QRS, hyperkalemia, ventricular rate. Oh, I think I may have got you on this one. Regular. And my last one was irregular. These are the things you have to think about when you see a rhythm and you don't know what's going on. Is it narrow or wide, fast or slow, regular or irregular? Those are the things you have to think about super quick. Just say, what is going on here? Am I fast or slow? Am I narrow or wide? Is it regular or irregular? The 3 questions that you want to ask. I separated that last one so I could give myself 4 questions on there. Okay. Here we go. 2 more on here. All right, what do you think? AFib Rhythms. Okay, I've got KJ's typing in rhythm, Brenda's rhythm, arrhythmias, a flutter. It is rhythms. It is arrhythmias. Atrial arrhythmias, gray. And oh, I can't see who typed that in. Carrie. I think Carrie typed that in. Atrial rhythms and gray. Brenda, Courtney. Yes, y'all got it. Yes. SVT. And my last one that I was thinking about was WPW, atrial rhythms. Matt, yes. 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 Okay. And Esprit, yay. Hey, Esprit. Okay. I have one more here. Okay. So what do you think about this one? Normal sinus rhythm. Normal sinus rhythm. You may not know where my head was going on this one. I'm going to give you the next one. Sinus bradycardia. Now you may know where I was going with it. Normal sinus rhythm. Yes, Carrie typed in sinus rhythms. Gray typed in sinus rhythms. Yes, this is what I was going with. Normal sinus rhythm, sinus brady's, sinus tachycardias, and dysrhythmias, sinus dysrhythmias. The ones that Jennifer actually she showed yesterday, one that when you're breathing and you might get a little bit of irregularity. Yes, deep chata. Yes, sinus rhythms. We got that one. Okay, last round. This one should be super easy for you, but you do have to type the words in. All right, for example, this was missing vowels. And here's the word. The category was black and white things. This is the example. And that's the letters up there at the top. You would have to figure out what that word is and put the vowels in. Oh, yeah, Carrie has it. It was newspaper, yes. Now, I made it a little bit easier. I actually give you a picture of what I want you to think about. So, okay, that was the example. What do you think? Here's the word. Here's the word. Oh, Brenda, oh my gosh, y'all are so fast. Y'all are so fast. Yes. I was going to give you a picture. Gray's already got it. KJ's already got it. Oh my gosh, I can't even believe y'all are typing that fast. I can't even type that fast. Yes. Torsades was what I was thinking about. Yeah, Courtney says she couldn't type it either. I know. That's why I'm on this end, because I had to check my typing before my spelling before I made the game up. Okay, here's another one. Let's see if you can think of this one. Here's my word. No spell check. I know, right? Oh, Carrie's already got it. Gray's already got it. Sinus tack. Yes, and I can see Facebook is also typing in. Well, they're Leslie, Lee, they're all typing in torsades. I gave a little bit of this one. This was a type of sinus rhythm. And yes, sinus tachycardia. How many points for these, Brenda? These, you know what? The game didn't tell me how many points these were. Let's give them all 3 points. 3 points if you got it. 3 points. We'll just make that up and I'll go back and put that in. Okay. I have just a couple of these. Okay. I don't know about this one. I don't know if this is going to be as easy. I don't know if this one's going to be quite as easy. Oh, you got it. Carrie, Brenda, accelerated junctional. Yes. I made a little picture here. Accelerated junctional is normally junctional rates are 40 to 60. And if it's over 60, it doesn't have a P wave, or the P wave is inverted or retrograde, then it's an accelerated junctional. Accelerated. So it's a type of junctional rhythm, accelerated. All right, y'all got it. Leslie, Matt, Deep Chatna. I can't believe you're able to spell all this stuff. I seriously had to check my spell check on all of these. Okay, what do you think about this one? Hopefully this one's not too difficult. Yep, ventricular tachycardia, Brenda, Courtney, fast fingers. Esprit says fast fingers, that's for sure. Yes, ventricular tachycardia. And torsades is a type of ventricular tachycardia. It's a little bit different and treated differently, but this is a ventricular tachycardia, type of ventricular arrhythmia. Yes. Brenda, did you used to be a court transcriptionist? Yes, for sure. For sure. I think so. And I even took shorthand in school way back when. Okay. Tell me what you think about this one. Tell me what you think about this one. Atrial fibrillation. Yes. Now, when I looked at this, I have to tell you, I thought this was hard. So I definitely put a little picture here for those that didn't see it. But this was actually atrial fibrillation, atrial fibrillation. Okay, and I think I have one more, last one, and we're right on time. What do you think about this one? And Lee says atrial fib on that one. Leslie got it. Deep Chatna, Matt, y'all got it all. Okay, and then Gray got this one. Courtney, KJ. Oh my, there we go. Carrie. Okay, I had to see who all was answering the question. Yes, and I put one on here that had a pretty good one. It was kind of a flutter. It wasn't a super regular a flutter. Esprit, Lee, yes, y'all got it all. Another type of atrial rhythm, atrial flutter. And that was it. I got a little, that's a horse. In case y'all didn't know that, that's a zebra. And I put on there Baby Yoda because for all those people that are maybe just learning, that's kind of how we look at things. And again, I want to give credit at the end because this is a new game. I want to make sure that that person gets all their credit. So I left their name on there too. Okay, Jennifer.
Thank you, Michelle. Thank you. I think that's my favorite game yet. KJ says the horse wants to be a zebra, right?
He does,
Harry,
yes.
Harry says that was so much fun. I agree. If you guys like this, let Michelle know because she makes our games for both the 30-day and the 3-day. So if you like this game, tell her so we can continue. She does all sorts of things like Family Feud. You name it, she's done it. So guys, this was exciting. I saw all of you getting like some amazing answers. You made me really proud. So what we're going to do now is we're going to transition, kind of change from game mode into learning mode. And we're going to cover some basic 12 lead stuff as promised. So this is again, day 3, our last night, but we're going to be giving away at the end of the evening, the scholarship as have been talking about for the last couple days. Remember, this is in honor of my dad. This is for somebody who has been very helpful. I will tell you that honestly, the person who won this round, so I'm actually picking the number 2 person, is KJ, because KJ already has a scholarship in our group. Because KJ, even when I'm like not awake and KJ's awake and she sees questions, she answers them for me. She's been giving out the replay. She's been answering things. So literally, KJ rocks. But I'll tell you at the end, it's the second person who I'm voting as being the most helpful. But I do want to say that you are all winners in my book because you're all have been showing up and learning and helping each other. And it's just been making my day. And because of that, okay, because of your interaction, Michelle and I chatted and we decided that we like you guys so much. We've been having so much fun with you. We don't want it to end yet. So we're going to do a bonus session on Saturday, which is in 2 days at 3 o'clock Pacific Standard. On that session, we're going to do something different. We're going to do breakout sessions. We've done this previously. I don't know, maybe 6 or 8 months ago. And you're going to get to come in my session with me. Half of you will come in my session and do some rhythm stuff with me, a little bit of 12 lead, and then you'll go into Michelle's session. And then we'll just swap back and forth. So you guys get to do each, but it'll be a place for you to experience getting to ask questions, getting to interact with us. We get to interact with you, and you can kind of get a sample like of what it's like to work with us, and we get to enjoy your company a little longer. So how many people are excited and want to come to that session, the bonus session? Yeah, I know. I hope you guys can make it because the breakouts can't be recorded. So hopefully you can make it live. It'd be great if you could. So getting into the nuts and bolts of tonight's training. Oh, Carrie can make it. Rock on, Carrie. We're going to be happy to see you. Brenda, it was a little celebration. Our court transcriptionist, Brenda. Okay, so how accurate is machine software? So let's just dig into this, guys. Here's the reality. It is not very accurate. And so if you are, like I once did, using the software interpretation to make your treatment decisions, you're going to be wrong anywhere from 6 to 42% of the time. And you don't really have a miss rate that's acceptable with EKGs. So the moral of the story is that you have to actually learn the things. Okay. So that's kind of why we go over it so much in this class. And also we continue on in the 30-day because we want to make sure that you don't get burned, because if you lose your license or injure a patient because of your lack of knowledge, right, then that's just awful. And we are anti that. So you start with knowing what normal is. And so here's Remy again. And Remy's just reminding us that all the intervals should be normal, the numbers at the top of the group. We should have a normal voltage, so not too tall, not too small. We should have the family holding hands, the mom, dad, baby, right, all holding hands. And that the T wave should be upright in every lead and a little asymmetric, as Michelle reminded us so elegantly. But they should be inverted in AVR and V1. And if they're not, there's problems. So the normal EKG should look something like this. Now there's, as we mentioned, right, no artifact is huge. If you have artifact, it can mess up the interpretation up here of these numbers. And then you could be in hot water, like we talked about, I think it was last night or the night before. They're blending. But I showed you an EKG of a very long QT that was not right. So we actually have to do the measurements ourselves sometimes if there's artifact. Paul is here to save lives. I know you are, Paul. You're amazing. So going on with this, here's what's normal. Okay. First of all, we have the mom, the dad, the baby, all holding hands. They're not going away from each other. The voltage isn't too big. It isn't too small. We have all of our T waves following the rules, right? Upright, 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 upright. All these guys are upright, 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 and then inverted, inverted. And all of the intervals are normal. So the normal intervals, we'll talk about this more in the 30-day, but just know that all of these are normal. And then, of course, one last thing I want to share with you that is critically important is that when you are looking at an EKG, what is so paramount is making sure you don't have ST elevation. So what you're going to do is you're going to take and make a line like this blue one all the way across. You're going to make that on all of the leads on your 12 lead, because that's the way you don't miss the ST elevation. That's very subtle, because you only need, in most of the leads, one small box. And if you're like me, and maybe you wear reading glasses now, right? If someone's life depends on 1 millimeter, we better know where to draw that, right? So here's where to draw it. And again, we practice this in the 30-day, because I know that a lot of you have probably never heard this before, but the end of the T to the beginning of the P is called the TP segment. And that is where you always line up with, and you make your line. So you can see that there's no ST elevation here. There's a little here, but it's not meeting criteria. There's maybe a little depression here, but not here. So there's a little wandering of the baseline, which isn't a big deal. That's why you have 3 beats, right? So you can actually see. So the moral of the story is this EKG looks pretty good, pretty normal. And this is what we're always going to kind of measure against to know what is normal and what's not. Now, I'm going to share with you my 10-step system, but I'm going to argue that Michelle actually has a better one. She has a better one. And she actually has a clock method, and it is so amazing. So Gray says, I'm just reading your comments really quick. New AI is really cool, more accurate, but expensive. Need to learn ourselves. I agree. 100%. Yes. Okay. So this is a 10-step system. I'm just going to kind of sketch this out for you really quick. And then there is a page in your workbook that you can use to go through and write this down to practice if you want to. Okay. The workbook's completely optional. But the first thing you got to do when you're looking at an EKG, and especially if you're new, guys, make sure that you're not missing a STEMI. So things that are basic, okay, when you're looking at an EKG, are going to bypass you doing the rest of the things on the list. So it's funny, because when I was paramedic, I didn't know this was just a paramedic thing they taught us, but they would say, oh, good, Michelle can show the clock on Saturday. That would be amazing. So they taught us, hey, if someone's big sick, you load and go. You don't stay and play, a total medic thing, right? Because we always had to make a decision as medics. Are we going to put an IV in here? Are we going to push drugs? Are we going to do our thing and kind of set up camp? Or are we going to, get going? So that's kind of what we need to do with our EKGs, wherever we are, hospital, clinic, ambulance, right? We need to go, are we going to, if it's big sick, do we need to stop, drop, and roll? And like, if it's STEMI, go to the hospital, get them to the cath lab. If they're asystole, start CPR, right? We don't care what the axis is. If it's a STEMI, we don't care, right? So once we figure out that they're not big sick, we go down and we can do the rest of the things. Okay. So we can look at rate, too slow, too fast, rhythm. What is it? We've talked about how to figure that out. We did a lot of practice yesterday. And if you're in our 30 day, you're going to get more practice later in the month with our rhythm expert, Sean. And then we're going to look at the intervals, those numbers, and then that includes the axis, which, by the way, I'll share more about this in the 30, but the axis isn't really that important. I know that sounds crazy, but it's really not that important. It's really only important if you have a wide complex tachycardia and you're trying to decide if it's SVT with aberrancy or if it's something else. Otherwise, not that important. And also, if you have a pulmonary embolus, you could have a rightward axis. Hypertrophy and voltage is very important because if you have a small voltage, we talked about before, it could be a pericardial effusion. Big voltage could be left ventricular hypertrophy. And then we're analyzing the T waves. And I got to tell you that there is literally, we could spend hours on the T wave and all the things it can tell you, all the little shapes it can make, and all the things that that means. But we already kind of laid the foundation saying that they should be upright and a little asymmetric, right? Except for AVR and V1. And then we're going to see if there's Q waves, and then we're going to go back and use what we call a chief complaint based approach. So what that is we're looking at the patient based on their complaint. So if, for example, they're shortness of breath, we're going to look for an S1, Q3, T3 pattern, which we're not teaching in this course because it's a little bit more advanced, but it's a pattern that you need to look for on someone with shortness of breath. But getting back to STEMI, because we were just talking about that, there's terms that we need to know, and then we need to know what artery feeds what so that we can fully understand it. Now, I'm going to lay it out for you here, but I'm going to tell you that in our 30, we do this in a way where Michelle shows you on her skelly and anatomy and her heart, and then I show you in our workshop. So we basically have you understand it with color coding. That's a lot easier than laying it out this way. But because I know some of you aren't going to join us, I want you to have the info at least here so you can reference it. So contiguous means leads that are fed by the same artery. So like, for example, 2, 3, and AVF, A inferior. And then reciprocal changes, for STEMI, you need to have them. And if you don't have them, you could be dealing with, for example, a STEMI mimic. Okay, so if you have ST elevation, the very next thing you need to do, if you've decided it's significant, is look for opposite reciprocal changes. So depression in the opposite leads. And we go through where those are as well, but that's really important. And if you don't have them, you could be dealing with a pericarditis. So here's a reference slide for you showing where the location are of the infarcts, what artery feeds what. Okay, and some of the things you might see. Again, you can save this, download it, whatever you want for reference. But at the end of the day, for me, this never worked. I needed to have a little chart, like a color-coded chart to understand reciprocal changes. And we give that to you in the 30 if you're going to be joining us. Don't worry. But this is a reference slide. Now, I wanted to share a little case with you so we could practice doing this really fast. A 71-year-old male, he's got chest pain. Of course, this is not anybody's real face. And what he's saying here is that he has his pain provoked by lifting a heavy box. So that's technically exertional pain, which is a bad sign. And that's how I get my cardiologist's attention if I say exertional, or it feels like my last MI. That's really bad. It goes to my jaw, my back, my left arm. Well, that's a classic presentation, right? That's typical chest pain. That's something that is absolutely, I'm already worried. Like this guy has a history of stents. He's diabetic. He feels lightheaded. So I'm pretty willing to guess he's either bradycardic or has low blood pressure. And oh, actually, it was his blood pressure and the fact that he is a STEMI. Okay. Yes, red flags, exactly. And hard on stick. Yes, I know. Exactly. So let me just run through how I would look at this. Okay. So if you have a guy that has a complaint like that and he comes in and here's his EKG, here's what you're going to do. You're going to go, okay, now I have a STEMI accusation. So I need to decide, is it a STEMI or not? I'm not doing my 10 step. I'm literally just going to make my lines. KJ always says, make your lines. Okay. I'm seeing there's inferior elevation. I know I just need 1 millimeter. I know this meets criteria. These are contiguous because they're fed by the same artery, 2, 3, and F. And then I know I need to go over here and look for my reciprocal changes, which is depression, and I have them. So is this a STEMI? Yes. Is this also potentially a right ventricular infarct? Yes. How do I know that? Because there's more elevation in lead 3 than lead 2. But this patient, I don't care about that right now because they're going to the cath lab. And that's kind of how we roll with this. Okay. Yes, it is an inferior STEMI. Good job, KJ. Please remind us of the CME. It is a 30 day is a 12 CME hour. And no, we don't have any farm credits, unfortunately, although we do have a lot of farm in the course. Okay, so going back to our workbook, we do have a way for you to refresh and practice this. So let's do this together really quick. Contiguous leads are, Jack says, looks rather not pretty. I totally agree. So contiguous leads, they are fed by the same. Good job. Carrie, good job. Okay, Gray, good job. And then reciprocal changes, basically for STEMI, you need to have, and I'm going to do this, the sign language for it. You need to have, I always throw these signs, but you need to have 2 up and 2 down. Okay, 2 up and 2 down. So 2 contiguous and 2 depressed. Okay, so opposite, exactly. That's what it means. Now let's run through what the inferior leads are. So they are 2, 3, and F. Okay, 2, 3, and F. Good job, Jean. Yeah. 911 is my friend, Paul says. I know, totally. Same. And they're fed by the right coronary artery. So you guys can fill that in. The anterior leads are V1 through V4, and they are fed by the what artery? Thank you for writing that in, Carrie. Who is it? It's the LAD. Yes, Jacqueline. Yes, Carrie. Good. Okay. And the lateral leads are 1, AVL, V5, and V6. Okay. And they are fed by the what artery? Who's left? Yeah, good. All right, awesome. So that's the circumflex, right? All right, good. So let's keep going. Here it is filled in case you need it. Good job on Facebook and also Zoom. You guys are amazing. This is just a reference for you to go through the answers if you want to. Here is the workbook page showing your 10-step approach. You could practice writing it out, but I'm going to tell you that once you see Michelle's clock graphic, you're probably never going to want to go back. It's so good. So we'll be showing you that on Saturday in her session. So that will be super exciting. But just in case to refresh, you could go through, and I think that seeing it this way is great as a list, but in her clock formation, it's also just going to kind of hammer this home for you. Okay. The chief complaint-based approach is important as well, but again, remembering basic, don't pass go, don't collect 200 if they're a STEMI. And then this was an example for you. If you wanted to in your workbook, you could go over here and you could color that in and you could say, oh, that's the sinus node. Oh, that's the AV node. And then you could label the bundles if you wanted to. You could label the little Purkinjes and you could just go crazy on this if you wanted to. And then this was our normal EKG example, but I'm going to ask you guys, and you can tell me later, this is a little homework for you. You can tell us on Saturday, okay? There's 2 things that are not normal on this EKG I put here. And you can tell me later, but there's 2 things that are not normal. And notice what the machine says, normal ECG. So it's wrong a lot of the time, okay? Can't trust it. Now I'm going to share with you one case before we wrap up for the night. And I just wanted to share this with you because this patient has an EKG finding that is one of the ones that should keep you up at night. And I'm just going to really quickly honor the fact that there was a time where that was me, where in the very beginning of my career, my best friend that's known me for like ever, she's an ER nurse now, but we were paramedics together. And she goes, I don't know if you remember this, but when you first started cardiology, you used to call me all the time. And you would say, I don't know if I can do this. I must be missing something. I'm terrified. She was reminding me of that. And I was like, I just have to honor that and be totally transparent with you because I know a lot of you feel that way. And knowing that you can come from that place to get to confident with just having the right steps in place, with just having the right people leading you, right? So this is one of those things that should keep you up at night. So there are things that probably shouldn't, but things that should. And this is one of those things. Okay. So he has shoulder pain. No chest pain, but it's when he works out. Okay, so that's a big deal. It's exertional. And here's his EKG. And yeah, Courtney, oh my gosh, it's going to take you a long time to feel confident. It really is a long time. And you're going to question it for a long time, but just know that, gosh, what, 16 or 17 years into this now as a provider, and I still feel like there's things that can throw me. I work in the ER in cardiology. I was a paramedic for 13 years. You would think there was nothing, right? But there still is. And it's good to know your limits. It's good to know that there are things that can still throw you, because that also makes it kind of exciting, right? It keeps you studying, it keeps you honest. And this guy, right, his EKG is bad, very bad. This is someone that, okay, I'm just going to share with you, needs an urgent cath. He has widespread depression that's very minimal, very hard to see, okay, with elevation, which is probably the most important thing, okay, elevation in AVR of at least 1 millimeter. So it never trusts the machines, exactly. So widespread depression plus elevation in AVR is always ischemic until proven otherwise, unless they are tachycardic, okay? So this guy ended up getting a stent in his LAD, and this pattern is never going to be read as go to the cath lab. It's going to say non-specific ST wave changes. Guys, that's the thing that should keep you up at night. And that's what we do a whole class on at the end of the month and the 30. So you get comfortable with these findings, because these are the things that you will lose your license on, guaranteed. Like, they are going to bite you. ER nurse for 12 years, NP and EM for 5, new to cardiology. Haven't felt this scared in years. I totally understand. I totally understand. Yeah, so thank you for mentioning that, Michelle. I do have a mentorship that we're starting next week. There is 2 more spots left. So Courtney, hit me up if you're interested. We do small group sessions where we just teach new providers that are cardiology providers. Oh, you're already in. Okay, then you're gonna love it. It's gonna be amazing. You're in the right place. So, okay, let's talk about tonight's prize, the scholarship. I've been waiting all day to tell you who the winner is. So let's announce it. The winner is Carrie Porter. Now, Carrie, you have been just such a great supporter of people. Carrie Lamb was also so great. There was a lot of people on here who are amazing. So Courtney, you're amazing as well. Like, everybody's been amazing. But Carrie messaged me. I'll connect you with the details. Congratulations on being our scholarship winner. Thank you for bringing positive energy and encouragement to our community. We really value you. So congratulations. Everybody's congratulating you, Carrie, and we're very, very happy. Really quickly, the difference is going to be between the mentorship. So Gray, if you're a new cardiology provider, it's a very small group. We meet for 6 weeks. We have 6 live calls. We have access to all the recordings of our basically hypertension, how to manage it, cardiac farm, heart failure, how to manage it, just EKGs. But if you want more of an EKG focus, the 30-day is really the way to go. And that we have lots of spots in. It goes for 6 months, so you get a lot more support. Today, in fact, we had David, our EKG guru. Every 2 weeks, he does study hall, where you submit EKGs and he breaks them down, and you can be on and ask questions with him. He's literally the best EKG brain on the planet, I think, personally. So that's kind of the difference. Ruben, maybe if you're still on, you can put the links. The mentorship is 6 CEs, and it is $349. And here's the link for the 30-day. It depends on what level of provider you are for the pricing. And the pricing is, for a student, it's $149 with no CE, and it's $299 for a NP or PA. And then there's RN and EMS pricing as well. The link is right here. Go ahead and click that if you want to check it out. But that's the differences. And I'll talk more about it on Saturday on our bonus class if you want to wait and kind of ferret it out. But a couple things is that the president should always run the heart. Remember that. Don't trust your EKG interpretation. The PQRST is really important. The family should always be holding your hands. And we're going to talk more about the intervals on Saturday on our bonus class if you can make it. And of course, we will definitely drive this home for you. So let's talk about what's in the 30-day a little bit, just a little brief snack. This is our schedule. So basically, we had a study hall today that was David does every 2 weeks. We're going to do our first kickoff call on Monday at 5:30. We're going to dive deeper into EKG terminology. We're going to share with you how our group works, where to find things, who to ask questions to. And then you're starting on the 16th with Michelle at 4 o'clock PST doing basic 12 lead. And then at the end of the week, we're going to do basic arrhythmia with Sean, who you're going to absolutely love. He's a paramedic and he does dynamic rhythms for us. He's so good. We're going to have a fun left heart cath demo as a video game, which is so, so, so cool with Camille. Michelle's going to do a practice session. So you get to learn from her here and then practice with her on the 24th. More study halls. So submit your EKGs to him, right? Submit your EKGs and he'll cover them. He'll break them down. And then we're going to do that workshop where we're going to use the stuff that I send you in the mail to go over in the workshop. So we'll use our crayons, we'll use our workbook, and then we're going to do on this session, this is one of my favorite session of the whole month. We're going to do we're going to have actual patient scenarios, and maybe me playing a patient and maybe Matt playing a patient. And you guys have to guess what's wrong with us. We're going to give you the EKG. We're going to give you the tests you asked for, and you have to make a plan for us. It's super fun. So I'm really excited about that. And so the workshop that we do, we cover the 17 real EKGs. We do lots of coronary anatomy stuff. Yeah, the Australian times we're going to need to convert for you, Carrie. That's throwing a little bit of a loop here, I think, because I think you're like really opposite timing. So, but it's lunchtime. Okay, good to know. Good to know. So this might work out pretty good for you. Now, in addition to the live classes that I showed you, and they're all recorded, by the way, you're going to get access to everything we've done in the class for the last 3 years. So like there's a ton of lipid stuff, there's sleep apnea stuff, there's like more EKGs than you could shake a stick at. There's new CHF guideline updates, there's new cardiac pharm updates, how to use the anticoagulants, antiarrhythmic drugs. There's too many things to list. I can give you the whole list if you want to just message me. But basically when you join the 30-day, you're going to get in the box all the things, right? That are all on here. But you're also going to get, we put together this cute little binder for you that you're also going to get. And in the binder, you can store you can make it whatever you want it to be. Okay, it's got a little cover on the back. But basically you can say, oh, I want to print out Michelle's handouts for her 12-week class so I can practice them later. I saw Esperie's binder. It's so amazing. She's been with us for 3 years. Her binder is really thick now. But like you get to kind of decide what you want to put in it. So you get all of the stuff, right? You get live coaching, you get access to multiple coaches, you get 6 months in our group, not just the first 30 days. We still have more coming at you. And then everything we've done in the past. So here's the pricing for our 30-day EKG challenge. And we will be coming back on Saturday to do a really special session with you guys to really kind of help break this down for you and interact with you and talk to you, because this is different when we're talking to you, but we're going to talk with you and we're going to interact on Saturday, and then Monday we're going to kick off the 30 days. So it's KJ, it's 3 o'clock Pacific on Saturday for the bonus class. And Matt says just buy a bigger binder, right? Totally true. Okay, so Grace says great to have access to the ones in the past. So here's how it works for the CE. Everything in the class, we had CE for like the past couple years, but right now what the CE is for everything that's in the learning portal. So it's just the 12 hours of stuff in there. Everything in the Facebook group is where all the recordings are. That's just all gravy. Everything we do live is gravy. So like you could literally get into the 30-day, watch everything in the portal and get your CE and just be done, right? That's a possibility. So it just kind of depends, it's a choose your own adventure. You decide what you want to go to. And of course, yes, yeah, Jack. Oh, Jack, you must be Esperie's partner. We love Esperie, by the way, and her binder is the best binder I've ever seen. Michelle's is pretty good too. It's really almost a tie. But yeah, and then if you have a topic, we can cover it. We can get a guest that if you really want something, we can bring someone in. That's what we do is we try to bring more people than just me. Michelle does a lot of teaching, and we have other coaches as well that are just amazing. So here's all the things you get. You get the welcome kit, you get the 12 hours of CE, you get lots of classes every week, live support, you get lots of guest speakers, study halls, and it's anywhere from $149 to $299, and we can't wait to see you inside. So questions, comments? Let me see if I missed anything. Michelle, did I miss anything on the comments?
I think Gary just had, Gray had a question on the cost. It was back a ways on the mentorship plus the
Yeah, I see it.
30-day. Okay.
Yes. So the mentorship is a completely separate thing that I do with a partner so it's both of us. She's a Stanford cardiology nurse practitioner, and her and I do it together. So that is a totally separate program than this. So that's $349, and it's for 6 weeks, not 6 months. And it's very small group. So you're doing a lot of communication. We're doing a lot of information. And you have a learning portal with 6 specific topics, including heart murmurs. In the 30-day, $299 would be the price for the PA or NP. And you get basically, you don't get like the individual level support in the mentorship. You get basically more like group access in the 30-day, but you get longer, you get 6 months. And then we do give you a way to extend at the end if you want to stay in. A lot of people have been with us for a long time because we keep bringing new content, or they just they just like to just keep staying in, see what other guests we bring in. We're also going to have Gary on. I haven't announced that date yet, but he's going to come on. So if you liked his session, he'll be doing the 12 lead for us. So that'll be good. Okay. What else do we have? Oh yeah, Matt does a good patient. We do good patient scenarios. It's really pretty cool. And there is a lifetime membership. Yes, KJ. But once you're in for 6 months, if you want to stay with us for life, we give you option of lifetime membership. And a lot of people have purchased that too. So yes, Jack, Esprit is great. And we love her a lot. So tell her hi. And I think that's it for tonight. So guys, we'll see you back for one last hurrah. Michelle and I will have you in breakout sessions. We'll chat with you. We'll interact. We'll really solidify some of the stuff we've learned and practice more. And I'm super excited for that. So have a good evening. And Matt says, join the 30-day, invest in yourself. It's true. It's literally, it's a pretty cool thing that we've created here. And I say that because the community that we built, the students are just as amazing. They encourage you. It's just like this, but smaller, right? We don't allow anybody who's negative. We're like, here is your money, go away. So like, we just don't attract that kind of people anyway, because this is what we are here to do. Our mission is to serve you. Our mission is to get you better, to nurture you, period. That's it. So anyway, KJ says you'll join, you won't want to leave. I totally agree. Jean, thank you. And we'll see you guys tomorrow. Have a great evening. Bye. And message me, Carrie, so I can get you the scholarship stuff.